Did you know that rectal cancer accounts for 70% of all bowel cancers? Its late diagnosis greatly reduces the chances of recovery. Watch this video to the end to find out how to spot colon cancer and what to do to avoid it. The symptoms of cancer. In the early stages of this disease, there are symptoms that people often don't pay attention to. For example, fatigue and general weakness. Bloating and flatulence and feelings of not emptying the bowels completely. As with all digestive disorders, we attribute these problems to our eating habits. Alas, the problem may not be so innocuous. Anemia is another sign. It is usually combined with blood in the voiding. In fact, all these signs are interrelated. Blood loss leads to anemia, and this leads to tiredness and weakness. But it is the blood that patients pay attention to, as this symptom no longer indicates the norm. The problem is that bleeding indicates that a tumor has already developed, so it is extremely important to pay attention to the earlier symptoms and undergo diagnosis without wasting time. Basic methods of diagnosis: fecal occult blood test. It is necessary to have these tests every 5 years, and for persons suffering from rectal polyps every 2 years. In later stages of the disease, all of these symptoms increase dramatically. Weakness, bloating, bowel dysfunctions and a constant sensation of a foreign body in the rectum become impossible to ignore. This is followed by heavy bleeding, pain in various parts of the abdomen, and a discharge of pus and mucus. At this stage, the tumor not only significantly blocks the lumen of the intestine, but also releases toxins that poison the human body. Friends, the value of health cannot be overestimated, and it is the responsibility of each and every one of us to take care of it. We try to find for you really useful and easy to use recipes to promote health. It is better to prevent illness than to try to cure it. Support us by subscribing to our channel. What to do if a terrible disease has already appeared? Considering the aggressiveness of tumors, modern medicine advises to have them removed. How exactly this is done depends on the stage of the disease. In the early stages, the tumor is localized in the form of polyps. A gentle laparoscopy method is used to remove them from the intestine. If an analysis of the polyps shows that malignant cells have not invaded the root of the polyp, this is the end of the treatment. If the tumor spreads further, we will also apply chemotherapy or radiation therapy in addition to an operation. In severe cases, a part of the rectum has to be removed and replaced by an artificial stoma. This illustrates the importance of self-monitoring and detection of signs of disease, as well as the importance of preventive measures. Causes and prevention. Why does colon cancer develop? Statistics show that this type of cancer occurs more often in men, especially in those who eat a lot of red meat, sausages, sweets, spicy food, and abuse alcohol. In addition, such a calorie-dense diet often includes little fruit and vegetables, and therefore little fiber, which is essential for the function of the intestine. Changing your diet is the easiest and most effective way to prevent colon cancer. First of all, reduce processed meat products, sausages, and smoked meats in your diet as much as possible. Secondly, eat red meat 2 or 3 times a week and alternate vegetarian and fish dishes on the other days. Thirdly, give up alcohol, carbonated drinks and sweets. Replace them with fruit desserts and honey. And finally, don't abuse salt and pepper. Our diet should include whole grain porridge and, of course, vegetables on a daily basis. This way you will give the body the necessary amount of fiber and improve the condition of the walls of the rectum. Another small but very important thing is to drink plenty of clean water, at least a couple of liters a day. And how often do you examine your intestines, and do you monitor your diet? Tell us in the comments.